speak on laser and microleakage. Let me introduce the moderators for the session, Dr. Rajesh Pillai and Dr. Vivek V. Dr. Rajesh Pillai completed his MDS from College of Dental Sciences, Manipal in 1997. He then completed his diploma in laser dentistry from the University of Geneva in the year 2013. He is currently the professor and HOD of the Department of Conservative Dentistry and Endodontics and is also the director of postgraduate studies, PMS College of Dental Science and Research. Dr. Vivek V completed his BDS from Government and New College, Trivandrum in the year 1990. He joined the Short Service Commission in the Army and extended his services till the year 1996. He then went on to do his MDS from Government and New College, Trivandrum in the year 2000. He is now the professor and HOD of the Department of Oral Medicine and Radiology, PMS College of Dental Science and Research. I now hand over the session to the moderators, Dr. Rajesh Pillai and Dr. Vivek V, for introducing the speaker and moderating the session.
Can we start off?
Yes, sir.
Okay. Good morning to you all. I have the good fortune of introducing Dr. Ahmad El Gamal, currently a practicing dentist at Alba Smile Dental Clinic at Al Ain, UAE. Dr. Gamal was Assistant Professor of Laser Dentistry, Faculty of Dentistry, University of Science and Technology, Fujairah. A PhD holder in Life and Health Sciences, Dr. Gamal has an European Master's degree in Oral Laser Application from University of Nice, France. He has presented his work in several international conferences and has several publications to his credit, especially in the field of laser dentistry. Dr. Gamal will be sharing his experiences on lasers and microleakage. The topic is a slightly controversial topic, as there are two opinions regarding the applicability of lasers and success of lasers in checking microleakage in restorations. Let us listen to Dr. Ahmad El Gamal. Over to you, Dr. Ahmad, please.
Thank you, Doctor, for this presentation. Good morning, ladies and gentlemen. I'm so happy to be with you and to take part in this lovely event. And today we will talk about an interesting topic, which is laser and microleakage. Let me share my screen now. So is it okay?
Yes.
Yeah.
Okay, so we will start with the important question. Can we reduce microleakage with the help of laser? So we will try to answer this question through my PhD research work during my research in the University of Nice, Côte d'Azur, titled with the effect of laser irradiation on CAD/CAM ceramic crowns, mechanical, chemical properties, and bacterial microinfiltration. As you know, coronal microleakage has a constant interest in dental practice in the specialties of endodontics, prosthodontics, and conservative dentistry, and also is considered as a main cause of failure, strongly influencing the clinical longevity of dental restoration. The consequences may be economical for the patient and social insurance, but also link the bacterial complication with mainly infection. So based to the study of Jettersons in Switzerland that showed the survival rates of a glass ceramic crowns in posterior areas were 84% after 5 years due to biological complications like caries, periodontitis, and abutment tooth fracture. In France, with the same period of 5 years, cohort study showed over 7.3 of cases that the crown was no longer in the mouth due to infection reason. So to prevent microleakage, bond strength and bacterial leakage studies have been used as indicators of both retention and marginal sealing abilities of ceramic restoration with different surface treatment methods proposed to provide roughness and promote micromechanical retention. So the main aim of our study is to improve surface adhesion of CAD/CAM ceramic by proposing a non-destructive surface treatment methods and to decrease bacterial microinfiltration in restoration dentin interface. We based our research on a pilot study realized to analyze the capability of Nd:YAG laser, neodymium, yttrium aluminum perovskates, and carbon dioxide laser in order to modify internal surface of irradiated surface ceramic. So in this study, they used high output powers up to 30 watt. And according to results as seen in figures, high output powers damage the surfaces of the ceramics, micro cracks, mainly melting due to temperature elevation as seen in these figures with all parameters from 20 watt to 30 watts with carbon dioxide and Nd:YAG with 10 watt. So we decided to modify the protocol, especially laser parameters, and we add many experimental trials, including microleakage test. So we starting with the materials that we use two types of ceramics. The first one is lithium disilicate. As per manufacturer for cementation, we use hydrophilic acids, silent coupling agents, and resin cements. And as you know, the indication of lithium disilicates, mainly we use it in fabricating inlays, veneer, anterior and posterior crowns, and implant-supported crowns. The second ceramic is zirconia, and for cementation, we use, instead of hydrofluoric acids, the sandblasting, silent coupling agents, and resin cements according to the manufacturers. And also, mainly we use zirconia in crowns, in posteriors, and the implant abutments. For the laser, we use two different wavelengths. The first one is carbon dioxide laser, 10,600 nanometers. And the advantage of this wavelength that the ceramics has a high potential of absorbing carbon dioxide laser wavelength due to the content of silica. So that's why we use two different power, 5 watt and 10 watt, in comparison with the previous study that used high output power in continuous mode. The second laser we use, it is Nd:YAG laser. Nd:YAG lasers, mainly we use it in industry as a surface modification technique to form a glazed surface layer on ceramics. So we use in 10 watt, and according to black chromoforms property of this wavelength to be absorbed, we stain the surfaces with graphites, absorptions in black chromoforms, and the ceramic surfaces were black stains. So we prepared all samples and sectioned them with the isomate to obtain identical samples with the 3 millimeter thickness for both types of ceramics. Then we distributed all samples according to their surface modification with laser to the following. We have two control groups. The first group controlled without any treatment, even thermal treatment. The second group control receiving thermal treatment with surface ceramic surfaces. The group LT, it means that the samples receive laser irradiation on the surface and treated thermally in ceramic furnace that we will call it LT. The subgroups of the main LT group contains different laser irradiations, carbon C5, which means that carbon dioxide is irradiated with 5 watt. Carbon dioxide 10 watt, it means that we irradiated with the power of 10 watts. NdYAG, NdG, it means that treated with the NdYAG with the graphite stained on the ceramic surfaces, and Nd means treated with the NdYAG without the graphite. So if there is any effect of this graphite stain on the surfaces, we can compare both of them with the effect of the stain. As I explained now, this group laser radiation, we started with the laser irradiation, indicated with the letter L, then the thermal treatment with the ceramic furnace. The second group, we can see, the group TL. TL, it means that the sample is treated thermally in the ceramic furnace, then receive laser irradiation on the surface, and that's why we call it TL, with the same subgroup treatments. Here we can see the effect of laser on ceramic surfaces, lithium disilicate, and zirconia with different powers used, the 5 watt and the 10 watt for the carbon dioxide lasers with the 2 different ceramics, the lithium disilicates and zirconia, and for NdYAG lasers with the 2 different surface modifications with the stained graphite and non-graphites. And you can see clearly the effect of the NdYAG lasers on the surface. So for the chemical compositions we started, we did with the energy dispersive spectroscopy, EDS, to identify the chemical compositions of the samples before and after laser irradiations. So when we compare it in the control group, we got, hello?
Yeah.
Yes, the identified elements of an irradiated Emax CAD are very similar to those described by the manufacturers. So the same oxygens and silica mass percentage when we compare both of them. And when we compare a group control with the carbon dioxide group irradiated with 5 and 10 watt, we can observe that there are a slightly increase of oxygen and sodium and silicate with 2 different output power, 5 watt and 10 watt. Here in the NdYAG graphites groups, when we compare it, we got the same results as an increase of oxygen, sodium, and silica with NdYAG groups irradiated with 10 watt with the graphite or without the graphite surfaces. For zirconia ceramic, the identified elements of an irradiated zircad are very similar to those described by the manufacturers. The same oxygens and zirconia mass percentage, is around 62% in untreated and control group. So when we compare it with the group control with the carbon dioxide, 5 watt and 10 watt, we can see that there is an increase of a slightly increase of zirconia mass percentage for both types of a group. The same thing, with the graphite and non-graphites, also we can see the increase of zirconium and oxygen in both treated surfaces with the laser. So according to the result, we can conclude, according to the result, laser irradiation did not show chemical modifications, but it changed the atomic and mass percentage of the components. For the same experimental observation during laser irradiation, we observed the following under scanning electron microscopes. So you can see the surface control groups for both used ceramics. This is for control groups, that there is elevations and irregularities of the surfaces for both types of ceramics. And when we compare to irradiated surfaces, we can see more elevations and depressions on surface and some cracks and melting areas on ceramics when in 5 watt. And it's subsequently, it's increased with the increase of output power to 10 watts, and you can see clearly the cracks on the surfaces. This is in carbon dioxide lasers. In Nd:YAG graphite lasers, we can see the melting areas on the top of the surfaces. And with non-graphite also, we can see the depressions and melting areas also. Even, we didn't use the graphite, the black stains on the ceramic surfaces. This is in the lithium disilicate group. The same observation obtained with carbon dioxide, that there is an elevation and irregularity on the ceramic surfaces in 5 watt. But when we increase the power into 10 watt, we can see cracks on the surfaces and melting areas in Nd:YAG graphites and non-graphites. So we can conclude that melting and burning areas were shown due to the cumulative of heat of the laser irradiations, and the presence of some cracks with the variable intensities is related to the thermal elevation of laser irradiations. Another observation during laser irradiation, we measured the thermal elevation by thermocouple by 4 sensors attached to the back of ceramic surface and record the temperature rise starting with the ambient room temperature, 25 degrees, and the temperature reached to 32 degrees in carbon dioxide 5 watt, and it is increased with the increase of the power to 10 watt and reaching to 46 degrees in lithium disilicate surfaces, ceramics. With the same group, with the Nd:YAG, the temperature elevation is increased and reached to 74 degrees Celsius with the graphite, and with non-graphite, there is an extreme rise of temperature reaching to 87 degrees, which is very huge. In Zirconia ceramics, we got the same results with the carbon dioxide 5 watts, the mean temperature is arriving to 32 degrees, and subsequently there's an increase of temperature with the increase of power, 10 watt, for the lithium disilicates. With the zirconia, graphite and non-graphite, there's also an extreme rise of temperature for both ceramics, reaching to up to 110 degrees Celsius. So we can conclude for this part of observation that temperature increased more in zirconia than lithium disilicates ceramics. The second observation, we see that Nd:YAG pulse mode showed more temperature than carbon dioxide laser in continuous mode, and evidently the temperature increased when output power is increased. The third conclusion, we can see that the graphite could decrease the thermal elevation with the process of vaporizations on the ceramics of the surface of the ceramics due to this process with the effect of the laser, and the obtained temperature were inferior to centering temperature of the chemical change. The centering temperature for lithium disilicates arriving 840 degrees, and for zirconia reaching to 1,100 degrees Celsius. And now we can show you the mechanical test. We did it starting with the microhardness test that we did for 20 seconds with the force varied from 300 gram force, 2.94 Newton for the lithium disilicate, and 1 kilogram force for the zirconium. And according to the results, we can see from the first groups between the effects of microhardness between the group control 1 and group control 2 with the effect of the lasers, the effect of the thermal temperatures, that there is no any effect of thermal effect between group controls. And when we compare the other groups, we can see that microhardness value is increased in carbon dioxide 5 watt, while the other values of microhardness, it's decreased in all groups. And we can see that this is due to the microcracks appear on the surfaces, and due to the high laser irradiation, which decrease this value of hardness. For zirconia also, comparing to based on the control groups, we can see that the thermal treatment affect the microhardness values. So that's why when we compare this group with the group affected with the thermal TL, it means that thermal treatment and laser, we can see also the microhardness value is decreased in all groups. Also due to, you know, the cracks happened and the high use of the power during irradiations. So when we recapitulations the results, we can see that the only output power which increase the microhardness value according to the test, we can see that only carbon dioxide 5 watt, which did this value, while others output powers, it's varying without effects or decreasing the microhardness values. So as a general conclusions for all these observations, we can conclude that carbon dioxide, according to the results, showed that there is no cracks or melting areas. Also, according to the SEM pictures that show that there is a roughness on the surfaces, which is an interesting property for us to increase the adhesions. And also during laser irradiation, the temperature rise, reaching 32 degrees, which is acceptable for us. And for hardness values, it is increased because there is a lack of microcracks on the surface of the ceramics. So we exclude all other parameters and we keep only carbon dioxide 5 watt to continue the other test and to prove the adhesion between the tooth structures and the ceramics with the use of laser. Hello, do you hear me?
We can hear you.
So, okay. So we continue the other mechanical properties, such as...
Your video is not coming.
Sorry for that, doctor. So we continue. So
yeah, please, because we can see your screen and we can hear you talking.
Okay. So as a surface roughness, by using atomic force microscope to investigate the surface roughness of CAD/CAM ceramics, and wettability, surface wettability, to test the hydrophilicity of lithium disilicate and zirconia ceramic. And also we did, you know, an experimental on shear bond strength of carbon dioxide laser irradiating the 2 types of ceramic bonded to composite resin and dentin surfaces. Why? To determine the effect of lasers comparing with the manufacturer instructions by using hydrofluoric acids and sealant on shear bond strength of resin cements to lithium disilicates, and the comparison between carbon dioxide with using sandblasting and sealant coupling agent when attached and adhered to zirconia ceramics. So we did a new groups according to surface treatment as these manufacturer instructions, and the results obtained from our previous experience with the result we will show you. So we arrange and categorize these new groups with two control groups. The first control groups, no treatment with the first types of ceramic lithium disilicates. The same thing with zirconia samples. So we have two control group with two different ceramics. The group C, it means that lithium disilicates irradiated with carbon dioxide in combination with the use of hydrofluoric acids and coupling, silane coupling agents, and also the resin cements. The group D, it means for these also they use with the hydrofluoric acid, silane, but without use of lasers. So in these two groups, C and D, we compare the effect of lasers in addition with the manufacturer's instructions using the classical methods. The same things in the last groups, E and F, concerning the zirconia groups, we will see the effect of carbon dioxide 5 watt when compared with the sandblasting, silane couplings, and the resin cements. So we remind you, we use output power 5 watt with carbon dioxide. We irradiate the all surfaces in a cross pattern in continuous mode for 60, around 1 minute, with a working distance 2 millimeter from the focal points, which is 0.1 millimeter to the top of the surfaces in a constant movement. So according to the results of roughness test, we can conclude, without being in the details, that the surface preparation with carbon dioxide, hydrofluoric acids, and silane increase the surface roughness in lithium disilicates with the significant p-values around 0.37. The same results we got it when we compare carbon dioxide with the sandblasting and silane, which increase also the surface roughness in zirconia. So the using of carbon dioxide with the conventional methods, it means that it increased the surface roughness of these surfaces by increasing the irregularities on the top of the surfaces due to the effect of laser. Also, when we did, the surface wettability test with the measuring the angle of the drops on the tops of the surfaces, we can see also the combination surface treatment of carbon dioxide with hydrofluoric acid etching and silane bonding to lithium disilicate ceramic made the ceramic hydrophilic, which is very important for us. And the same result we get it also with the zircon-based ceramics when we combine carbon dioxide with the sandblasting and silane bonding. So this test also, we can, according to the shear bond test for the two studies, sorry, I didn't mention them in the test due to the time, because we did a lot of steps and details for these two shear bond strength. But we can conclude that the same result we get it, that irradiation carbon dioxide 5 watt increased shear bond strength between zirconia ceramics and resin cements compared to untreated surfaces. The same thing happened only with the dentin when the surface attached with the dentin. So when we have in the two types of studies that when attached to the composite resins or dentin structures, the using of carbon dioxide with the zirconia ceramics increased the shear bond strength. While in the other types of ceramics, lithium disilicates, there is no an effect of improving the cements with the use of lasers. For the last part of this microleakage test, it's under publication. We didn't publish it yet, but we can go briefly about the aim of this study to determine also the effect of laser with the same, the rule of sandblasting and silane for zirconia and for hydrofluoric acids with the silane with the lithium disilicates, both these grounds are exposed to monobacterial biofilms we created in our lab with our own protocol. With the same group treatments, we did it as we previously explained them. 2 control groups, lithium disilicates, 2 groups, the comparing of the effect of the carbon dioxide, zirconia, also 2 groups with the effect of carbon dioxide without the effect of carbon dioxide. We created also the monobacterial biofilm of Streptococcus staphylococcus, was designed and incubated for 21 days on ceramic surfaces and slides for both types of ceramics. We take, when we immerse both of ceramics, after we preparing the crowns, we irradiated the internal surfaces of the crown, then we slide them and we immerse them to biofilm to detect, the microleakage test with the confocal microscope. And we got this result that the confocal laser results showed that signal of Streptococcus probe were detected in all slides, which confirmed the bacterial microleakage. So there is no significant difference between irradiated and non-irradiated ceramic group. While in the other group, Zirconia, the results showed that there is a bacterial infiltration, but with a little difference between irradiated and non-irradiated. It means that it gives improved that lasers with using carbon dioxide in zirconia ceramics improve the adhesion and decreasing the marginal gap between the ceramics and the dentinal structures, which decrease the bacterial microinfiltrations according to the results. So in general conclusion, we can see that experimental observations, some thermocouple microhardness and wettability showed comparable results with different parameters. And according to energy dispersive spectroscopy, it proved that the laser irradiation on ceramic surfaces may cause some atomic mass changes without changing their chemical compositions. And also the third and the last conclusion, we can see that using a microleakage test by monobacterial biofilm infiltration demonstrated that irradiation with carbon dioxide laser could improve the adhesion between two ceramic interface and decrease the bacterial microleakage only in zirconia ceramics according to our results. There is a lot of limitations on these studies that we didn't treat the dentin surfaces, and also due to the water storage, we use only 24 hours of storage with distilled water for all samples, and for the thermocycling, we use only the long-term thermocycling. Also, other limitation, we use only one type of self-adhesive. We couldn't, and we hadn't the chance to use different luting cement system. In this way, we can compare this effects with the laser effects. And also for according to bibliography, the use of zircon primer on shear bond strength of zirconia, we didn't use it and compare it with the effect of carbon dioxide. So that's why also we try to do this experimental and clinically to determine the bacterial microleakage and adhesion values in clinical situations to see their effects and the longevity of these restorations with the patients. So you can see all parts of our test published in these articles, except the last bacterial test we didn't yet publish it. And thank you very much for your attention. And sorry for the disturbance of my voice, and because I was sick with the COVID-19, I was in quarantine 3 days ago. So that's why I'm still under this disease, and I hope all of you to be safe and in good health, inshallah. Thank you very much.
So thank you, Dr. Ahmed El-Gamal, for your wonderful lecture in adopting various strategies to improve the surface addition of CAD-CAM-based crowns, and also special emphasis on lithium disilicate as well as zirconia reinforced metal-free ceramics. And also, you spoke in length about the impact of Nd:YAG as well as the carbon dioxide lasers in bringing about changes on the fitting surface of metal-free ceramic crowns. And the last take-home message that you mentioned in the slide was improving the additional characteristics that the laser brings about in bringing about minor atomic mass changes rather than gross surface degradation. And you spoke about the various parameters in improving the microhardness values using various irradiation parameters as well as energy dispersive spectroscopy. And one question that is coming from our side is, you spoke about the biofilms. What is the impact of the Streptococcus salivarius induced biofilms in ensuring the longevity of ceramic crowns, sir?
You know, according to the protocols, you know, we must use, you know, biofilm with different, you know, types of bacteria, you know. But, you know, according, you know, to the difficulty to create and for the time for these procedures, and we are limiting in the time. So that's why we decided to use only monobacterial with the Streptococcus for the facility and for the easy manipulation and control of the microleakage scores according to the protocols. I didn't mean, you know, give more details about that, you know, because, you know, it is confidential and it is under process of publication. So that's why we hope that within the future days, we can give more details about this part of study.
One more query is, you mentioned that pulsed Nd:YAG lasers induce more damages on the fitting surface of crown compared to carbon dioxide laser. Why is it, sir?
Yes, because due to the thermal elevations coming from these types of lasers, it produce a lot of thermal, which, you know, cause damages on the surfaces and cracks and also melting areas according with, as you see in the figures and the SEM figures, you can see these melting areas due to this thermal elevations of temperatures.
Okay. Can this laser irradiation can be used as an additive in addition to the usual 9% hydrofluoric acid as well as the silane primer that we use? Do we get a better shear bond strength as far as a restorative dentist is concerned?
With which one? With the Nd:YAG laser or in carbon dioxide?
Yeah. With Nd:YAG lasers.
No, with Nd:YAG, no. I do not recommend to use the Nd:YAG lasers, especially with these types of ceramics. But, you know, with carbon dioxide, yes, we obtained and we got a lot of good results, especially with 5 watt. And sorry for that, when we compare it with the pilot study, when we're using a high power, reaching to 30 degrees, 30 power watts, we obtain the same things, micro crack. So that's why during, you know, the trials, I tried to, you know, to reduce gradually the powers till I reach, you know, 5 watt that I couldn't find any cracks on the surfaces. So that's why I say it is, you know, the optimal or the good power to use it 5 watt. Or even, you know, 4 watt or 3 watt, but, you know, the effect on the surfaces and the irregularity of the surfaces obtained by this laser irradiation mainly obtained with 5 watt.
So hypothetically, if you're using a 5 watt carbon dioxide laser, what parameters do you recommend to a general practitioner, sir?
5 watt.
Pulse mode and pulse?
It is continuous mode. In continuous mode, 5 watt.
For how long? For how long?
For 1 minute.
Oh, okay.
Only 1 minute.
Sir, what is your experience with this diode lasers in controlling microleakage?
Diode laser, we cannot use it with the ceramics. We cannot, because carbon dioxide, due to the silica, there's an absorption effects of carbon dioxide with this silica. So that's why you can see the effect of carbon dioxide on the top of the surfaces. While in diode lasers, you cannot see that. Due to, the wavelength properties of diode lasers, which cannot absorb in these types of silica.
So
but there are a lot of studies which says that that erbium, chromium, YSGG lasers can be used for control of microleakage. So that's why I was asking whether you have any experience with that kind of lasers.
Of course, erbium YAG with carbon dioxide, both wavelengths are recommended with using, ceramics modifications. Other types of wavelength, due to their characteristics and properties of these types of wavelengths, we cannot deal with them with the ceramics.
And regarding that privosite addition to that NdYAG laser, that is which makes it NdYAG, as it is, as you have mentioned, like is graphite addition a necessity?
Yes.
Of course, because the necessity of a graphite is due to the black chromophores and absorptions properties of these types of laser. As you know, the black stains or activate the laser irradiations on their mode on the surfaces. So that's why we stain the surfaces with the black to activate the work of these types of laser. We can also clinically, when we use also diode laser, we should activate the fibers with the black chromophores with the diode lasers. It's also the same things with the NdYAG. According to their properties, we should activate them. But comparing and regarding the experience, so that's why we did two types of ceramics with or without the black stains to see the effect of chromophores. Of the set of this NdYAG lasers on the surfaces, and we got the results. It is absorptions of these black stains, when we stain the surfaces, activated and give more results than the non-graphite. It becomes more, there's a side effect of non-graphite laser which burn the surfaces due to the high powers. So that's why when we are in discussions also, during this research, so what is the benefits of black stains, and we got the two results, two melting areas with the black or without in India. And according to discussions and conclusion, we can see that if you use high put powers with the NdYAG, you got the same results with or without graphite, especially with NdYAG.
And then one more question, that is whether when you are adding this graphite, will it compromise the aesthetics of restoration? That is
no,
because it is black in color, and once that microleakage part is what do you call it?
There is a side effects. You see, there is a lot of cracks happen. Why? Due to the cumulative of this heat on the surfaces. So that's why if you use it in the lab or the treating ceramic surfaces with the lasers, you cannot use these types of ceramics with the NdYAG lasers. Why? Because it reduces the hardness and increase the possibilities of being fractured.
So thank you, Dr. Ahmed, in shedding a new light on strategies to reduce microleakage in association with especially the hard tissue lasers. So thank you, sir, for your wonderful insight on this particular topic, and shows the amount of depth of research you have done to bring the research back into practicality. So now may I invite our beloved chairman, Dr. P.S. Taha, to share his words of wisdom.
Hi, Gamal.
Hi, Dr. Taha. How are you?
Fantastic lecture. You are wonderful in doing research. I know it is amazing. Very, 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 informative. I gained a lot of knowledge because we use simple lasers in practice. But, when you go deep into the topic, then only you know what are the limitations and what are the possibilities. So thank you very much and hope to see you personally at PMS College, and hope to have some, association in conducting courses and seminars like this.
With my pleasure, Dr. Taha. With my pleasure.
Pandemic is over. I think we'll go back to the normalcy. We will associate. Thank you so much. Thank you.
You're welcome. With my pleasure. Thank you very much for your interesting and beautiful events. Thank you, and best wishes for all of you.
Thank you so much. Thank you.
Thank you, sir. I thank our beloved chairman, Dr. P.S. Taha, our esteemed speaker, Dr. Ahmed, and I also like to extend my gratitude to Dr. Rajesh Pillai and Dr. Vivek V for moderating this session. We will be taking a short break now and will continue with the afternoon session. The next session will start at 12 p.m. I request all attendees to be present